Our next speaker is a man that I met several years ago, and he was really crucial in helping me develop friendships, relationships in the Southeast Idaho area. When I was given the job for the coordinator for the John Birch Society, I depended on people like this to be able to help me have other people not only know who I was, but to be able to better understand who the John Birch Society is. And Catherine has been a very good friend to me as well, making that happen, helping me set up events, and being there for me every step of the way. I'm really happy to introduce my next friend, I hope I can call friend, is Dr. Jud Miller from Rigby, Idaho. He's a retired emergency, family, and adolescent medicine doctor with over 30 years experience. He's married to a sweetheart, Catherine, and she is a sweetheart. They have 5 children and 30 grandchildren. Dr. Miller is on the board of directors for the Madison Liberty Institute in REXBURG, is a former candidate for the state senate, and a patriot who has a passion for sharing America's godly heritage. They live it and they breathe it every single day. Ladies and gentlemen, Dr. Jud Miller.
Thank you. Patriots and friends, it's good to be with you today. I don't know when I've spoken with a more illustrious group of people. It's a great honor. I want to thank Tom and Caleb for this event, for this idea, and for all of you for being here. Sometimes it's a little frustrating to be in the minority, and we definitely are a minority. We work hard, but we don't always see the results of what we do. It reminds me of a sign that was in the nurses' station in the VA hospital in Denver, where I did some of my training. The sign said, "Doing a good job here is like wetting your pants in a dark suit. Gives you a very warm feeling, but nobody notices." Thanks to you and to Tom and Caleb and to the efforts of many like you, we will make a difference. We will be noticed for what we're doing here. What I'd like to share with you today are some of my observations on this pandemic we're in the middle of. Now, we're all saturated with news from this pandemic, and I don't want to belabor that beyond where I should. But with my medical background, I have an interest in where this has been and where it's going, and I'd like to just share some thoughts with you about that. I suspect I'm preaching to the choir today. An epidemic is a disease that is spread among a community or a region. A pandemic is a disease that has a passport, spreads to other continents, to other countries. And there have been many such epidemics, pandemics, plagues in the past. Nothing is new. The serious ones from the past, like the Black Death, took 150 million lives. 60% of Europe died with the bubonic or Black Plague. This was in the 1340s. The Spanish flu in 1918. They faced a lot of the same things we do here. 20 to 50 million people worldwide died with that. Oh, a little closer here, is that better? With the Spanish flu, 20 to 50 million people died. So the powers that were then mandated, you've got to wear a mask. Unfortunately, in those days, the masks were a very porous gauze. It kept the insects out of your mouth, not the viruses. They would put people's names in newspapers when they wouldn't wear the mask. They would give them jail time. They would fine them. But they still had mask slackers. One overzealous health official in San Francisco even shot a man because he refused to put on his mask. We haven't come to that yet that I know of, but there's a lot of militant leaders who are pushing that idea, or that something similar to that. When this virus threat first came out, I remember hearing it on the news, and it was all nebulous. We don't know how it spreads. We don't know how many deaths there are going to be, but there's going to be a lot. We better hunker down. And we did. As a people, we hunkered down. We stopped going to work. We stopped going out. We didn't know what to expect. After a month or so, some more level heads began to prevail. People with medical backgrounds, people with science backgrounds, began to look at the hype and then to look at their observations in the patients they were treating. And the story changed. And the threat diminished in their view. And they began to spread their word, put postings on the social media platforms. And with my background, I gravitated to those postings. But I had a problem. The day after they were posted, they'd come down. They'd be banned. And that's the news that I believed. And it's been somewhat of a challenge to catch up with all of those, although there are other places you can find them. I began to wonder, why are they banning the opposing opinions? Why are they trying to scare us? When the deaths were rising, they focused on deaths. When the hospitalizations and the overcrowding in certain hospitals was increasing, they focused on that. When those things began to diminish, then they began to test the general public, the man on the street, to see if he was carrying this virus. They've never done that with a pandemic in the past. And those numbers were increasing, so that's what they began to report. Why are they promoting the fear? I couldn't understand that. Well, it seems that the cure was becoming worse than the disease. The task force in Washington, D.C., that has been driving the bus on policy have given a bunch of mandates. Wash your hands, which is always a good idea. Social distance, which may have some value. Sideline, that came from a high school science fair project. Someone who decided to see if social distancing would diminish the spread of a cold in their high school. That's where we borrowed that idea. And masks. Masks have become the most visible symbol of going along with the mainstream or not. And I get it. When the only source of your news is the mainstream media, you feel compelled to do all of these things. And I get it. People feel like they're saving lives. People feel like they're stopping the spread of disease. And I respect that. And I don't look down on them. I just hope they don't look down on me when they don't see a mask on my face. Because I've looked at both sides of the mask issue, and it's anything but settled science. Anything but settled science that masks help. It's interesting that those who focus on the mainstream media have a greater fear of the disease. Those who focus on the alternative media, where you and I focus, have a greater fear of the government. And it's interesting that the current political climate has brought out the latent tendencies in some of our leaders to exercise unrighteous dominion when they get a little authority, as they suppose, if you get that. Some of their actions border on martial law. We don't need that. Well, let me share with you a few of the things that I've learned from the non-mainstream news. Dr. Kelly Victory. Now, if you have something to write down, write these names down and look them up. I'm giving you just a snapshot of what they're saying, but they're saying a lot of very important things. Dr. Kelly Victory. She's an emergency room trauma doctor who is specialized in public health. She tells us this: The virus is real, the statistics are not. Because of incentives, the number of cases, the number of deaths have proven to be less than reliable. Some testing methods have come under suspicion, and that is to say the least. The massive testing of healthy people has never been done before, and so far has not been helpful. The only way that that can be meaningful is if you can relate that to people who are sick or who are headed for the hospital. But to test the man on the street and get worried about him with no symptoms, etc., that's meaningless. The average man on the street that they're testing is 31 years old. Young people don't die from this unless they have coexisting conditions. Dr. Victory also says that it's the natural history of any pandemic that the curve flattens once the initial spike happens. Very much independent of what a man can do. Quickly, another organization is America's Frontline Doctors. This is a group of doctors who have been treating the patients, the COVID patients, and have some definite recommendations, especially regarding hydrochloroquine. That has become a political football if there ever was one. Those who prescribe it and use it say it works great. Those who are afraid of it are those who don't see patients. One more name, Dr. Catherine Austin Fitts, F-I-T-T-S. She is a banker, an international banker, and she looks at the COVID situation from a monetary standpoint. She gives you some very insightful things. She says this is the mother of all debt entrapments, and it is a tool for global reset. She's a Christian lady too, and she tells us to read the story of Gideon, Judges chapter 7. That's how we're going to beat this. Where can we turn for help? America in the past has turned to God. Our history is a spiritual history. We must not forget that. I'm going to have to condense because my time is about out, but we must pray mightily for this nation. In times past, there have been days of fasting and prayer, and miracles have followed when we do that. We've got to be united. We've got to ask God for help. We also must inform ourselves and be part of the solution. We must get involved. Sir Edmund Burke said, all that is necessary for evil to triumph is for good men and women to do nothing. Samuel Adams said, it does not take a majority to prevail, but rather an irate, tireless minority, keen on setting brush fires of freedom in the minds of men. That's what these speakers are doing. That's what you and I must do. We must get off the sidelines and take part. I believe that America can be healed. I believe that America's best days ahead of her. God bless America. Thank you.